The teaching tool I created will be used to assist in the education of the ultrasound department to perform neonatal brain ultrasounds. In this presentation, I will provide a background of the educational experience, discuss the needs assessment, learning objectives, learning conditions such as environment and target audience, learning barriers, learning domains, teaching strategies, and methods of evaluation. Finally, at the end of the presentation, I will introduce the teaching tool. To provide some background on the topic, I will explain how the need for neonatal neurosonography came about. I'm sure you have heard about the Zika virus in the news. Zika is a fairly new disease that is transmitted through mosquito bites. The main concern with this condition is infection of the Zika virus in a pregnant female. If this occurs, the fetus could develop brain defects. Because of this, the CDC, or Center for Disease Control and Prevention, has begun to require a neonatal brain ultrasound prior to discharge in all infants born to a mother with the Zika virus. This, in turn, requires our ultrasound department to perform these studies. Because of the nature of this situation, a needs assessment was pretty simple. We did not perform neonatal head ultrasounds prior to this, so the need for education was obvious. However, there were further steps taken to ensure the education provided included all the necessary material. Although we did not perform these ultrasounds in our department, some of our technologists had prior experience from other facilities. This prompted a structured interview process in which the team leaders, including myself, assessed the comfort level and competency of our technologists that had experience. Upon conclusion of these interviews, it was determined that they would still need some training as well, as it had been some time since they experienced this type of ultrasound independently. Lastly, a group discussion was held with the radiologists, obstetric physicians, and team leaders. This discussion helped to ensure we included the information the radiologists needed to make a diagnosis and understand in what circumstances the obstetric physicians would want a neonatal brain ultrasound. From the needs assessment came the learning objectives. You can see from the keywords here that the verbs used are consistent with the understanding and applying level of Bloom's taxonomy. This is an appropriate level because this is a new study for most technologists. Even the technologists that have performed a study in the past still feel uncomfortable with the exam. Therefore, an entry-level education is fitting. The objectives are as follows. The ultrasound technologist will identify neonatal brain anatomy as seen on ultrasound. The ultrasound technologist will identify the appropriate acoustic windows and scanning planes to complete an ultrasound study of the neonatal brain. The ultrasound technologist will complete a neonatal head ultrasound exam as outlined in the ultrasound protocol. The ultrasound technologist will complete a competency with a proficiency score of 85% or higher. And finally, the ultrasound technologist will demonstrate proper technique through the completion of a study with the instructor. The last two refer to the method of evaluations of training that will be discussed in more detail later. Fortunately, the learning conditions in our ultrasound department are great. Everyone is supportive of one another and respectful. This helps to provide an attitude of teamwork between the technologists. The target audience was also helped narrow the information to be presented. All technologists are experienced in ultrasound and want to learn the basics of neonatal neurosonography. As a result, I could develop a presentation that skipped over basic ultrasound information, but did not go into too much depth and detail regarding the neonatal brain. Instead, we focused on what we would expect of the ultrasound and what anatomy or information the technologist should acquire. Even though I have a great department and team, it is not perfect. There will always be learning barriers to education. The biggest challenge we face is time. Unfortunately, in healthcare, we are often short on time and cannot spend several sessions reviewing material. To try to overcome this challenge, I developed a teaching tool that could be used independently and at the convenience of the technologist. Another barrier was a matter of resources. Upon researching the topic of neonatal head ultrasound, we discovered we did not even have the appropriate ultrasound transducer for this procedure. However, that situation was rectified fairly quickly by purchasing the transducer we did need. Our last challenge was a matter of availability. In ultrasound, we often practice on one another to hone in our skills. If we need to work on kidneys, we can grab a partner and scan their kidneys. However, no one in the department has a neonatal head. Ultrasound cannot penetrate or see through bone, so an adult brain cannot be imaged. In fact, an infant of 6 months is even too old to image because the fontanelles or soft spots have fused and become solid bone by then. To find a solution for this barrier, we reached out to a sister hospital that performs neonatal brain ultrasounds regularly. This way, we were able to send one of our more experienced technologists to train with one of their ultrasound techs. She then brought her knowledge back to the department and trained me with our first neonatal patient. Only after this was I then able to develop an educational plan. I must say that although lack of experience in the department was a barrier, I found benefits of it. For example, I was just as uneducated as the rest of my team. This gives me an insight into how the education was going to be for everyone else, and I made sure that the questions I had would be addressed in their education as well. 2 learning domains were used in developing this teaching plan in order to provide a comprehensive education. The determination of which domains to use was assisted by a research article by Delwyn and John. Their goal was to analyze the skills used and education required for ultrasound technologists. Not surprisingly, they determined that ultrasound technologists' skills were psychomotor in nature. However, they expanded upon that by describing 4 distinct abilities: the ability to image a 3-dimensional anatomy on a 2-dimensional screen, the ability to manipulate the transducer, the ability to image an organ in 2 different orthogonal planes, and the ability to identify and replicate optimal images. Although these are all physical skills, they depend on something Delwyn and John called a visual exemplar. A visual exemplar is an example of an optimal image. So, in using my example from earlier, if a student were learning to scan kidneys, the student would first need to see several images of an acceptable kidney ultrasound image, along with education to obtain that proper image. Thus, in order to obtain the needed psychomotor skills, the technologist must first have the knowledge and visual exemplar. So, with that knowledge, it was determined that both the cognitive and psychomotor domains needed to be addressed. The cognitive domain, or thinking domain, helps to lay the foundation of the educational material. It also helps to define the expectations of the skill to be learned through visual exemplars. The psychomotor domain is the skill of actually performing the study and ensuring an optimal image is captured. Demonstration would fall into the psychomotor domain and is helpful in elevating confidence in the learner's abilities. To fulfill both the cognitive and psychomotor domains, the teaching strategy was developed to consist of multiple stages. First, the technologist will receive the foundation of education through a lecture presentation. Next, the technologist will be provided with a simulation through the teaching tool that we'll be discussing in a little bit. And lastly, the technologist will observe a demonstration and produce a return demonstration with me, the educator, during their first neonatal brain ultrasound. Evaluations are necessary to determine the success of the educational program. Because there are multiple stages to this teaching plan, there are also multiple evaluations. The first evaluation will be a brief competency exam that is required every time we initiate a new protocol or information session. The second evaluation will be completed by the instructor during the return demonstration. The technologist will be competent in the exam when she successfully completes the competency exam and is observed producing a satisfactory neonatal brain ultrasound study. Finally, I will introduce the teaching tool. The teaching tool I created is an interactive PowerPoint presentation that will help to provide the visual exemplar as well as some psychomotor skills for neonatal brain ultrasound. So my intention is to introduce the teaching tool at the end of the lecture presentation, but just in case some of the technologists forget or it takes them some time to actually utilize the teaching tool, I have created some instructions to refresh their memory. So the first slide we come to addresses the acoustic windows for the neonatal ultrasound. So pretty much the acoustic windows in ultrasound is where our transducer is going to be on the body. So the physical landmark or spot that you need to place your transducer in order to image the structure that you want to look at. So in this case, the neonatal brain. So like I mentioned earlier, ultrasound cannot see through bone. So when it comes to infants, the only way that we can image the brain is through the fontanelles. So that's pretty much what these are here. We have the anterior fontanelle, posterior fontanelle, mastoid, and the temporal window. So not only can the technologist see where their transducer will go on the baby's head to achieve these different windows. Here's towards the front, back, behind the ear. So on top of that, they will be able to click on these links to reveal the images that are associated with that window. So if we use our anterior fontanelle as an example, I will go ahead and click that. Now there are two planes that we must image in the anterior fontanelle. So that's what this is, our coronal views and our sagittal views. So as a technologist reviewing this, to understand, I'll say, well, I want to look at my coronal view. So I will go ahead and click that link. And then this is a very good visual of where your transducer is, what scan plane you're looking at, and what image you're going to see or you should see. So here's our transducer. Again, we are still in the anterior fontanelle, so it's in the front. And it says we're sweeping anterior to posterior. So that means we're going front to back. So these are my scanning lines. So we're saying that when my transducer is here and I am angled towards the front, I should see this image here. Now, to know what exactly is in this image or what to be looking for, I will click on that image. It'll bring that up a bit larger so that we can see it. But also when I go click again, it'll highlight the landmarks. So a lot of ultrasound is knowing your landmarks and your anatomy so that you can say, yes, I interrogated the area to its fullest extent. So what I am telling the technologist here is this is the image that you would see, and here are the structures that you should visualize to make sure that you have an optimal image. Again, goes back to that visual exemplar. So I'm telling them this is your inner hemispheric fissure. This is the frontal lobe, and here are your orbits. So when you're scanning coronally, your anterior-most image, these are the three things that you should be seeing. So if I go back to my coronal image, I can continue through those. So I will say my second image, as I come back a little more towards the back of the head, this is what I should see. Again, I click and the landmarks are highlighted for me. Now, once I have completed all these steps, say I'm on my last image, or even from here, find my last image, I have seen that, I can go back here. Now, I know that I still didn't look at my sagittal views, so I will go and do that. So if we go back to the beginning, same thing happens with the rest of them. So my temporal window, I click on that, and there's really only one image associated with this, but here we have an image showing where your transducer or the ultrasound probe will actually be on the baby. And here is an example of the image that you should see. Click again, the areas are highlighted for me. And you can continue that through. So this is really meant to be completed independently to just get a feel for where your transducer is supposed to be, put that 2D image into perspective with the three-dimensional object of a neonatal head, which is something that we do all the time. It's something that ultrasound techs have to do throughout schooling too. So even though this is two-dimensional, this is one of our fundamental ways to learn, which is why I think it will be pretty successful. Now, as I mentioned earlier, some of the benefits of doing this project was that I was inexperienced as well and was learning this as well. So as I was going through creating this teaching tool, there was something additionally that I think could have been beneficial for me, so I've added that to the presentation. So although those images with the landmarks highlighted are very helpful, as an ultrasound tech, I still want to see that image, black and white, by itself, kind of test my knowledge and identify that. Because at the end of the day, when I'm scanning a neonatal brain, there will not be blue, green, yellow colors highlighting the anatomy. It'll all be in black and white, and I have to identify that. So my intention is after you have gone through this, you will click the image review. So when you go to the image review, you can pretty much select any image from, and it has the windows down here, from any window down here. So I'll just click one, and now it's just this image. So I can kind of test my knowledge and say, okay, this looks like lateral ventricles here. This is an hemispheric fissure, Sylvian fissures, things like that. So this is intended to be a test your knowledge at the end after you've thoroughly reviewed the rest of the teaching tool a few times. So at the end of the day, I think this will be very beneficial, especially because we don't have control over when the technologist will actually be performing this study. So this is one of the best hands-on ways that we can give them right now. And also, it could be hit or miss. It could be several months before we get another study. So this, I think, would be a good thing to have in your back pocket for when you do get that patient, and you can at least review, refresh your memory, see actual images before performing the study. So we haven't implemented this yet. We'll see how it works, but I'm very hopeful and I think it will be very successful.